So, hello everybody. Here we are with Michael Hoyt, psychologist, psychotherapist. He is one of the original member of the first group that study single session therapy with Moshe Talmon and Robert Rosenbaum. And now here we are to talk about the recent development about single session therapy and to have an overview on this amazing topic. So, how are you, Michael?
I'm fine, Flavio.
Uh,
Thank you for your interest in this.
Thank you to be here. Are you ready?
Yes,
Okay, so first of all, Michael, I'd like to know from you what is the now of single session therapy. 2 years ago, you and Moshe Talmer have edited a book. This book, Capturing the Moment, a great
I
book.
have.
Yes, and we are waiting for the Italian translation.
Mhm.
And this book is, in my opinion, the most complete book of single session therapy.
Yes.
Um, so, what is the now of single session therapy? What we are seeing in the present of this field?
I think the now of single session therapy, what's going on right now, is more and more it is being recognized that many clients do come for one visit or one session. Uh, and so we ought to find ways to help take advantage of that. How can we make the most of that one session? Since statistics show that the majority of people only come for one or a few visits, we have to work with that reality. So one of the nows is recognizing that one session is the most common length of therapy. Actually, no sessions, zero is the most common length. People think of coming to therapy, but they never go. But among the people who go, all the statistics say one is the most common. Two is the next most common, three, et cetera, et cetera. So most therapy is brief. Another one of the nows, another one of the current developments is more and more we're recognizing that single session therapy can be used with a wide variety of problems. In this book that Moshe Talmon and I edited, and in another book by Arnie Slive and Monty Bobel, we review all of the research that's been done. And there are many studies where one session helps somebody with anxiety, with depression, with an eating disorder. We're not saying that one session is necessarily all people need, but we ought to let the client help decide what the right length of treatment is. So we're seeing more and more people are recognizing one session can be enough. A week ago in the Huffington Post, which goes all around the world, there was a big review article about this book. And they talked about one session may be enough therapy. And they gave lots of examples for people with post-traumatic stress and depression and all sorts of problems. So I would look at the Huffington Post, its article as
The
well.
article, I read it.
Another recent development is when we did our original study, it was in 1990, it was published on single session therapy. We did it in Northern California. And a lot of single session therapy was being done in the United States and some in Canada and some in Europe, of course. But now we're recognizing that it is an international phenomenon. We're getting reports from Turkey, China, Israel, Haiti,
Italy
Cam-
too.
all sorts of different countries, all sorts of different social classes. So I think there's going to be a recognition much more of the value of one or two sessions for people. I think a barrier for many people has been go to therapy. I'll have to go for years. It'll take a long time, a lot of money. I need some help now. I don't want to spend years. So this is very exciting for people to find out, well, maybe I should go once or twice and see what I can benefit.
I think
There's, please,
if
yes,
you
sir.
if you catch a point, a very interesting point. You say actually the more common length of therapy is zero because there is an high rate of no-shows. And so I ask you, do you think that a lot of people don't come in psychotherapy because they are afraid to be years in therapy and to spend many monies for therapy?
I think they can have a little taste or a little sample, an appetizer, and see if they like it, and see if it's something they want more of. But they may decide the appetizer is all they needed. They just want a little bit. They got the help that they wanted. But I think many people are worried if I go. I had a friend who went to therapy and he had to go for many years and he became dependent and he had all these problems. I think another reason people want to go is they're worried that if they go to talk to a therapist, they'll have to talk about every bad thing that ever happened to them. It'll be very painful. It'll be very sad. It'll be embarrassing. So I think it's good for people to know I can go and talk to a therapist and he will help me figure out how to use my strengths to get better rather than I will have to confess everything that's bad. I'll begin to look at my better part instead of my worst parts. I think that makes it.
And I think that we can find a lot of benefit also in the public service. You work for many years in one of the biggest HMO in United States, right? Kaiser Permanente. Okay.
Correct.
So, what do you think that are the benefits for public service, public healthcare service, mental health care service that adopt single session therapy?
We used to talk about 80-20 rule, and we would say that 20% of people used 80% of the services, that a small minority took most of the services. And it would be better if we could give people just what they needed when they needed it, so that we could give people more services that needed more services, but not give a lot of services to people who only need one or two visits. So I think more efficient, and it would be more appropriate. People would get what they really need instead of everybody gets the same or everybody gets more than they really want, that sort of thing. So I think first of all, we should have more counselors, more therapists, more psychiatrists, more helpers. And even then, there's still going to be a lot of people needing more services. And so we need to find a way to give just the right amount. So I think by giving brief therapy to most people, we can save long-term therapy for the people who truly need long-term therapy. I don't think it's brief versus long. I think most people need brief, and some people will need continuing or long. How to have enough for everybody is the question.
I think that one of the biggest resistance to single session therapy probably is from the inside of psychotherapy. Can you explain to the therapist how is possible that you can solve a problem in one session?
Many of us have had a conversation with a friend or a family member, or we went and we saw a movie, or we saw something on television, and it changed us. It gave us a new direction. It gave us a new idea. Maybe it did not solve all of our problems, but it inspired us. It gave us courage. It gave us some ideas of what to do. So in single session therapy, sometimes we solve a problem, get rid of the problem. But sometimes we don't solve it. We get some ideas how to approach it differently, and then we can work on it on our own without having to continue going to see the therapist. I hope that answers the question.
Yeah, I was thinking that so is a very interesting thing because in the private practice, often I don't heard about follow through or follow up. If you do single session therapy, is very important to do a follow up, a follow through to see if a patient after 3, 6, 12 months it's better, it's okay. So, do so do you think that we have to change our ways to do psychotherapy? Because psychoanalysis, for example, is not so good like it was. I was talking with a psychoanalyst some days ago. She says we can work like some years ago, and there is probably a huge diffusion of brief therapies. So, what do you think? It's necessary to evolve, to change our mind, to be. You often speak about to be multi-theorical.
Yeah. I think we capture the moment, but we also create the moment. And the traditional theory of psychotherapy has been that it took a long time to develop these problems. It will take a long time to uncover them, and then a long time to gradually correct them. We will have to work through. We will have to process. We will have to, piece by piece, undo them and rebuild them into a better way of being. That theory means it will take a long time. But we find many people say, if I can just get a couple of ideas, I could take the ball and run. I could do it on my own. And we're finding many clients say, oh, once I recognize what I was thinking or what I was telling myself, once I realize other times I've been able to do things differently, I'm able to make changes more quickly, that I don't always years and years. Another problem with psychotherapy is the economic basis of who gets paid. And if you see patients quickly and briefly, you always have to get new patients, where from strictly a making money viewpoint, it is better for the therapist if the patient comes every week forever. Then they keep giving me money every week forever. It was a famous therapist named Jay Haley who said, we should find out who it was in the history of psychotherapy and put up a statue to honor them. He said, who was the first person that decided we were paid for units of time instead of results? If you were told, we will pay you $500 when Mrs. Smith stops having panic attacks, they would have developed quicker ways to get $500 to get her to stop having panic attacks. But if they said, you will get $100 a week forever as long as she keeps having panic attacks, it probably will take longer to help her overcome panic attacks. So I think the economic basis is very, very important. I don't mean to sound cynical, but I know that when there's only a limited amount of time, we tend to focus on what will work quicker and better, when if we think it's going to take forever and we have an endless amount of time, the work expands or contracts to fit the time allowed. Most of us, including me, study for the night before. When we know it's time we've got to do it, we get serious and we do it. Yeah. And so Jay Haley would say to his patients, I saw him do this on videotapes, and I knew Jay a little. He would say, if I told you we were only going to meet one time, what would you want to focus on today? Oh, well, if we're only going to meet one time, then I have to figure out what I want. He wouldn't even say we are going to meet. He'd just say, if I told you we were going to meet. It was hypothetical, but it was a way of focusing or concentrating on what was most important. Sometimes therapy does take a long time, and some people have a very difficult situation and need continuing help. So I'm not saying therapy is always bad, but most of the time, I think when people are seen for a long time, there's always the question, why did it take so long? What were they doing week after week after week? So I think it's very helpful to figure out what is goals, how to get them motivated to make some change. There's a saying I like, if you don't change directions, you're going to wind up where you're heading. If you don't do something different, it's going to be more of the same. So they've got to change something in their behavior or their thinking or their emotions, their feeling. If they don't change anything, it's going to be more of the same. So I think we have to have a clear goal. We have to figure out where they're or what problems they're having. And it helps them, when did they not have a problem? When was the present problem not present? When were they doing better? What's the exception to the problem? What were they doing then? Maybe they could do more of what they were doing when things were better. Many times people have anxiety, and I'll talk to them and I'll say, well, sometimes you get nervous, but you don't have a panic attack or you don't freak out. Oh, and they tell me how they think and differently. And I say, well, why don't you do more of that when you're dealing with the problem? And it helps them shift to coping or being adaptive or using their strengths rather than just having the idea I have to look more and more into the problem and into what's wrong and go deeper and deeper, into a hole. So I think having a goal, looking for exceptions to the problem, motivating the client, these are all very important. If people could solve their own problems, they would not be coming to the therapist. Somewhere in this book, here it is again,
Yeah.
on page number 7, I have a little drawing, circles. And the circles say alliance, goals, and resources. So I think we need to develop an alliance with the client. We need to figure out what their goals are and what their abilities or resources are. If we had an alliance and we talk about their goals, but we don't access their resources, therapy won't happen. If we talk about their resources, their abilities, and we have an alliance, but we don't talk about their goals or why they're there or what the problem is, therapy won't happen. If they could put their resources and their goals together, they wouldn't need us. The alliance, where we help them figure out how to use their own abilities better to solve their problems. There's an interesting controversy that's been going on. I think largely what we try to do is help clients better use their own resources or skills. But sometimes we also teach them new resources and skills, how to communicate better, how to relax, how to think more clearly. So I think sometimes the therapist expertise is really helping the client become an expert for themselves. And other times I think the therapist's expertise is lending them some ideas that we have learned that they may not be aware of, that their thinking is too narrow, or they don't know how to calm themselves, or they don't motivate themselves. So there's an interesting sort of balance between when we should teach them something new and when we should mostly try to be Socratic and get them to recognize their own their own abilities.
Perfect.
Yeah.
Thank you, Michael. You are very complete. You give us a lot of things to think about.
I want to ask you a question, though.
Oh
May I
yes.
ask you a question,
I
Flavio?
hope my English is good for this.
Here's the question. Why are you interested in single session therapy?
I think I want to answer to this question. I started to study psychotherapy, and I want to become a Jungian analyst. But one day I asked to my master, a physician that was teaching me Jungian analysis, how many years you need to solve a problem to a patient. And he answered, with an adult, about 4 years, no less of 4 years. And I thought, it's impossible, 4 years? You came with a panic attack and you need 4 years to solve your panic attack. And so I started to interest in brief therapy. And in my research, I always search for the better ways to achieve a good result in the smallest amount of time.
Yeah.
And I think that the key in single session therapy that fascinating me is that you actually use the client's resources. It's not your therapy on the client,
Yeah.
your techniques for the client. I'm a good therapist with this problem. No, is taking the client and, as you say, uh, making him expert of himself.
Yes. Uh-huh. That's a very interesting and good answer because it tells me you wanted to help people more quickly and you recognize that the people have their own abilities. It would be better to use their abilities. It's interesting because I, early in my career, was very interested in Jungian psychology. One of my professors was a Jungian, and it was wonderful to listen to him talk. And then I was reading an interview with a famous Greek therapist named Paul Watzlawick. And Watzlawick was trained as a Jungian analyst, and he did Jungian analysis. But then one day he said, in the interview, he said, I knew all about Eskimo creation legends, but I didn't know how to help their child stop wetting the bed.
Yeah,
Thought I should learn more practical approaches so I can help people quickly rather than just the legends and the myths. And it's all very interesting. I like it, but people come wanting help. They don't just want a story. They want. I have a particular problem. I need some help. Anxiety, depression, relationships, whatever. And I think many of us were in the same situation. And when I started at the Health Maintenance Organization in California, people would come with a problem, and I would say, well, maybe you need to come 10 or 20 times. So we could really understand. And they said, that many? I just want to get some help. Do you have any ideas? What could I start doing now? And so I began to have to rethink, therapy is supposed to help people as soon as possible. And even the metaphors we use, like when you were talking, you said, I have to be a tough therapist. Resistance, like warfare. We have to beat them. We have to defeat them to help them.
yeah,
Maybe it's better if we are making music together, or we are cooking a meal together, or we are dancing together. How can we cooperate rather than this conflict model? So I think some of the brief therapy becomes the art of recognizing what's good about the person rather than just what's wrong or what's missing, trying to see the strengths. And I think it's a very nice answer you gave. Thank you.
thank you, Michael, and thank you for this interview. And I hope to see you soon. And
Likewise, and I hope people will find this very interesting. One of the things about this book that's very good is that people wrote chapters from very different perspectives. Ericksonian, psychodynamic, narrative, solution-focused, medical family therapy, lots of different approaches. So it's not just one idea, a lot of different ideas. That's why I think people will find it interesting.
yeah, I think this is the better book about single session therapy, and I can't wait to see it translate in Italian. We just wait a few months, and if you want to know about single session therapy, read this book, you user, because this is very good book, a very powerful book.
Thank you.
So, thank you, Michael, and see you next time.
I'll see you next time.
Bye.
Bye-bye.